So my name is Pamela Trivedi, and I am the Infant and Early Childhood Team Lead for our National TA Center for Child, Youth, and Family Mental Health here. And we're really excited to offer this new learning community on provider and educator well-being. So let me just start off by talking a little bit about our content and the great facilitators that I'm joined by today. Next slide, please. Myself and my two facilitators all work at Georgetown University, and the content that we're going to be presenting today was put together by our colleagues at Georgetown, and originally for teachers in a curriculum called Teacher Wise to support teacher well-being across domains. And then it was modified by some of our colleagues at the University of Maryland and also by our colleagues at a partner TA center, the Central East Mental Health Technology Transfer Center, to be made appropriate for providers who are serving children, youth, and families. So we're really excited to share this curriculum with you all. Just as a cautionary note, NTAC, our TA Center, is funded by the Substance Abuse and Mental Health Services Administration, SAMHSA, which is part of HHS, part of the U.S. Department of Health and Human Services. But the views presented today are just the views of our facilitators and presenters here and are not the views of SAMHSA or any federal entities. So NTAC is part of a multidisciplinary team of some really wonderful partners that we're proud to serve with. So we are led by the Center for Child and Human Development at Georgetown, and CARS, the California Applied Research Solutions, and just a number of other really wonderful organizations that have some excellent mental health and family advocates. Change Matrix, which is our equity partner, has really helped us understand how equity is the center of all our work in behavioral health systems buildings. FREDLA is an organization that has wonderful family advocates and leaders. Youth Move National centers the voice of youth advocates with behavioral health issues. And we're also joined by the AAP and other parts of Georgetown as well, and also the Texas Institute for Mental Health, which does some great work on peer supports and partnerships. Next slide, please. So our goal at NTAC is to ensure that all children, youth, young adults, and their families who have emotional and behavioral health needs can access evidence-based supports in a coordinated fashion, and that these services are really built around kids and families with behavioral health needs in ways that serve them appropriately. Next slide, please. I hope that today on this, in our new community of learning, we have lots of great folks from across sectors. Usually we are lucky to work with state and local agency leaders, members of the mental health workforce, including folks who are social workers, clinicians, home visitors, infant and early childhood mental health consultants, primary care providers, folks who are school-based behavioral health professionals, and folks who work in the community in various ways as peer support providers, family providers, or youth advocates. Next slide, please. So I like this infographic that just tells you a little bit of the kinds of services that we offer. We offer individual consultation, peer learning exchanges, lots of different learning opportunities, tailored technical assistance for folks who are building out their systems of care. This is our new learning community, a community of practice. We also offer a lot of webinars. We are getting into offering podcasts and kind of other forms of social media that are really exciting. And if you logged in and are on our mailing list, you probably have received many of our 5 Things Digest on different topics, sort of helpful links and information on different topics. I'm really excited to be joined by my wonderful colleagues from NTAC and Georgetown. We are all mental health clinicians in addition to sort of providing training and technical assistance. So we're lucky to be joined by Shai today. Shai is a licensed marriage and family therapist and also a kind of a family relationship scientist. So she's also a public health researcher, and Shai's clinical practice focuses on adolescents and kind of parenting teens and young women who are mothers or young parents in that perinatal period. So Shai just does a lot of great work and has done some excellent work with underserved communities here in DC. My very good colleague, Mike, from our infant and early childhood team, is a licensed clinical social worker who just has an amazingly vast kind of clinical experiences. Mike just got back from being deployed, help an overseas assignment in which he was supporting some of our deployed soldiers and offering infant mental health consultation and child focused consultation to soldiers and families who are deployed. So just really important service that Mike was involved with. And Mike has just worked in sort of almost every aspect of early childhood systems that's available, both on the clinical side and on the program management side. So we're really excited to have Mike's expertise as part of our team here. And as I mentioned, I'm involved in the infant and early childhood team. I've done a lot of work on infant and early childhood mental health. And this year I was super lucky to be in a clinical setting where I provide therapeutic support to middle school and high school teachers and staffs who are serving a really diverse set of youth here in DC. So let's go ahead and jump into our content. We're going to start by kind of setting an intention together for this work. I'm just going to say a couple words about well-being before I go ahead and turn it over to Mike. Just that in our work together in the COP, we're using the term well-being to include physical well-being, but also occupational, so kind of job-related, intellectual, social, and emotional well-being. And we'll dig into what all of those domains mean. And just a couple of notes that we know that there are a lot of factors that influence well-being, including kind of the climate and culture of your organization, workplace relationships, and your family and cultural context can also influence things like how acceptable it is to kind of regulate or not regulate your emotions. So all of these things are super important. And I know kind of in some of the work that I do with teachers and other school-based professionals, when I was talking about well-being, one really kind of insightful colleague noted that, well-being is really a collective rather than an individual endeavor. So that's why I just think it's really a pleasure to be able to connect and work with you all in this new learning community. And on that note, I'm going to go ahead and turn it over to my good colleague, Mike. Go ahead, Mike.
Okay, thank you, Pamela. Quite kind introduction. So I'm going to dig a little deeper into the concept of self-care and what it means to those of us who do this work. One of the things that I'm struck by, and I was thinking about this presentation, was that so many of us, most of us, do this work because we care. It's because we care about perhaps the education of our youth or the treatment of our young people, and we give of ourselves in that caring. And it is this caring that also makes us quite vulnerable to a lot of different things that can really start to bring us down and impact not just our emotional health, but our physical health as well. And so as Pamela talks about intentionality in looking at the different things that we are doing, it's a real important idea to keep in the back of your mind. Can I be intentional about self-care and about taking care of myself? I really like this illustration right here of the adult helping the child with their mask. We are in this period of COVID, and so this is something that is relevant today. Oftentimes, when we do a presentation like this, we like to use the analogy of taking a trip on an airplane. And before you take off into the pre-flight instructions, flight attendants and the pilot often give the instruction that should oxygen be needed, a mask will drop down, and that you are to place the mask on yourself and then assist others around you who might be traveling with you. And this is a real important concept. And it also goes to the idea that what we do is not selfish. That caring that I spoke about earlier, we often do because there's an altruistic sense of doing better for those who are coming behind us or for the good of others. But being intentional and being strategic to a degree and self-care is really a higher form of care of others. And so with that kind of altruistic pose that I talked about, I think that opens us up to thinking that I can do these things later. Many times we will query participants about what are some of the self-care things that you do. And often the majority of the self-care items that are presented are items that are done after one leaves their place of work. I read, I write, I listen to music, I sing, all of these things that are very good and are wonderful ways of taking care of oneself. But what we're talking about right now is the idea of being in the moment, being able to take care of oneself, being able to step back in a reflective pose and wonder, why is it that I'm beginning to feel this way? What is this angst about, perhaps? And we are going to do certainly many more presentations where we will dive into reflective practice, what it means and how to really embrace it so that it can help us on a very high level. But what I would like to do today is to make sure that as we talk about self-care, it is an understanding that it is intentional, it is in the moment, and it is something that not only impacts our relationships with the children that are in our presence and the other adults, but there's also a parallel process that I often talk about where other relationships can impact the moment. And so it's quite a bit of many different things that come together. But what we want to do is to ensure that there's a degree of intentionality about taking care of oneself, making it a priority, and not making it something that Scarlett O'Hara might do and say, oh, I'll take care of it later. No, the time is now. The time is in the moment.
We are all susceptible to stress and burnout, and that's especially true for people in providing roles, caring roles. You have to juggle many, many things, and sometimes it can feel like you're taking care of everybody else and not yourself or your family. And that's worth paying attention to. And I imagine wanting to make sure that you stay on top of this and not get to a point where you are burnt out is part of the reason that is motivating you to come to these community or practice sessions, which is really great. So when we use the word stress in this program, we're referring to the physical, mental, and emotional response to events that can cause physical and mental exhaustion. Of course, as I'm sure most, if not all of us know, stress comes from a situation or a thought that makes you feel anxious or nervous or frightened. And we know that a little bit of stress is good. For example, when you are preparing for a test, when you're in school, you want to be kind of stressed about it because you want the A or the B, but you don't want to be so stressed that it turns into test anxiety, or you can't focus on studying, or your mind goes completely blank during the test, right? When you get too activated, it can detract from your process and make whatever you're trying to deal with harder to sort through, and from whatever, it makes it difficult for whatever issue is you're confronting to be resolved. And so I want all of us to be intentional about making sure that we don't get to the burnout place, and that we know how to respond to issues with flexibility and resilience, and ultimately improve our capacity to serve students and families and whomever comes into our offices or our classrooms. Thank you, Mike and/or Pamela, whoever ended up sharing. Thank you for that. So this work, in order to protect ourselves from burnout, requires a lot of intentionality. A lot of people in the field that we're in and doing the work that we do feel physical and emotional exhaustion, and they can experience cynicism and detachment and feel ineffective and like they have not accomplished anything. And that can be a very dangerous place to get into, because especially when we feel cynical, it can make it difficult to properly assess and diagnose a crisis situation. People can end up getting hurt, bad things can happen. So we really want to make sure that we're all taking care of ourselves. And to that end, next slide, please. We are going to do the Poise Wellbeing Self-Assessment. And so what this is an assessment that allows you to capture how you're doing in several key domains. I think Joanne is going to paste, you won't be able to click on this because it's in the presentation, but Joanne, yeah, thank you, just posted the link to this in the chat. So what I'd like all of you to do is take the assessment, click on the link, take the assessment. It should only take about 5 minutes. And then we'll walk through it together. You won't need to share out your results, but I want you to use this as a baseline for where you are today at the beginning of this community of practice. And hopefully it'll help highlight areas that we will focus on, we can all focus on together as a group moving forward. So if you haven't already, go ahead and click on the link. And thank you everyone who shared in the chat. That's awesome. I appreciate your honesty. Okay, so as you will see, once you complete the assessment, there are 5 key areas that this assessment targets. The first 5 items are in green, and they refer to your physical well-being. So how are you doing in terms of sleep and eating and exercise, etc. Questions 6 to 10 assess occupational well-being. So how are you doing at work? How are you feeling about work? Are you still feeling fulfilled? Are you approaching burnout, etc. 11 to 15 are in purple, and they refer to your intellectual well-being. Do you feel stimulated? Are you still enjoying things the way that you used to? Do you still think about exciting things in the same way that you used to, or do those things that used to be exciting now feel dull and uninteresting? Numbers 16 to 20 are in blue, and they measure your social well-being. Do you feel socially supported? Do you feel connected? Do you feel like you have a community or a village? And then finally, numbers 21 through 25 are in pink, and they measure your emotional well-being. Can you sit with painful emotions? Do you feel calm and peaceful most of the time? Do you have good ways to manage stress, etc.? So what I want you all to remember is that your well-being in each of these 5 areas will vary over the course of time as the school year progresses, as the year progresses, the holidays affect it, summertime affects it, wintertime affects it, etc. So just remember that where you are now is not necessarily where you'll be in a couple of months, for example, but we do still want to keep an eye on it and try to do this assessment with some regularity to get a sense of where you are at any given time. Over the course of the 5 minutes that we spent doing this, you may have come up with results that show, I'm not doing so well in a particular area, which is okay. That's why we're taking it. That's why we're doing it. But we want to figure out why that might be and what we can do to get you to a place that feels good. So this program, this community of practice, is designed to meet your changing needs, to really hone in on the areas where you aren't doing so great, and get you to a point where you are feeling like you are doing fairly well, if not really well, in each of the 5 areas. There are some other areas of well-being, of course, like spiritual well-being and financial well-being, et cetera. But we thought that this particular assessment was concise and hit on 5 of the key areas. Obviously, there are other important ones as well, but these, I hope, will help give you a solid foundation in terms of places where we can bolster how you're doing. And then once you're doing well in all of these areas or most of these areas, then maybe we can think about the financial, spiritual, et cetera. We won't be able to cover those in this particular program and practice, but hopefully it'll feel like a solid foundation that you can use to springboard into other areas if you are interested in that.
Sort of ideally, we were hoping that people would think about their Poise self-assessment results and think about maybe what area they wanted to learn more about, or sort of get some support from peers in our learning community about exploring and think about goals that you may want to set for yourself. So in addition to our wonderful next session of this learning community, we also have a lot of other great stuff coming up for NTAC. And thanks so much for participating today. We really enjoyed getting to know you.